Obviously cocaine, once again, they don't mix too well. They're actually the same drug class. They're actually chemically very similar, and they're actually classified in the very same department in terms of how drugs work. What about if the drug doesn't seem to be working, if the dosage doesn't seem to be going too well? If you think this medicine is not working properly after you've taken it for several weeks, do not increase the dose. Instead, check with your doctor. Because remember how it's a stimulant that has a suppressant effect at low doses? So the danger you have if the dosage isn't working, if you self-medicate and increase, is once again, you may tip the scales in the favour of turning it into a stimulant. So you're better to go back and reassess that situation rather than doing it yourself. So Nick's golden rule number 2 for tonight: if you choose medication, no caffeine. Look, just, it's the best way to go, is just avoid caffeine. So that's coffee, tea, Coca-Cola, Pepsi, all these energy drinks that are really popular nowadays. Even chocolate, there's caffeine in chocolate too. And if you choose not to medicate, then probably minimise caffeine. In fact, what you can almost do is if you get good at it, you can actually sort of keep a low dose of caffeine almost and use it as a little bit of a medication in a sense. But once again, you need to minimise the caffeine because these kids don't respond well to stimulants sometimes. So in terms of looking at some of the deeper issues of what happens when we start to medicate our kids, it starts to get a little bit more confusing, and it starts to get a little bit more depressing even. What we're finding, and this is from the USA, we're starting to see this. I've heard of this happening at one of our local secondary colleges last year. They started having a few cases of this, but in the USA this is very, very common. We know that ADHD kids often have higher IQs than the rest of us. They're actually often quite intelligent, more so than the average person. So they're not silly. So what some of them have worked out to do is they pretend they take the tablet, they put it in their pocket, they go out to the locker room and they sell it for $5. And their mate goes and crushes it up and snorts it or smokes it or even injects it. And as we mentioned before, it's the same addictive drug class as cocaine, morphine, opium and heroin. It's called vitamin R is what they like to call it. There's a couple of other names they give it too depending upon how they take it. But it's quite a lucrative business for these guys. Actually, some of them make quite a good living out of it. You can imagine if they're taking 2 tablets at lunchtime and 1 tablet in the morning, then that's $15 a day they're making. They're doing pretty well, some of these kids. The other thing that we see sometimes with these children is what's called a cocktail, where first of all the child goes in and they're given the Ritalin, and then the next step is they're not sleeping too well. They're a little bit teary now. They seem to be a little bit overactive in their emotions. So they go back to the doctor, and the doctor says, "Oh, well, that's easy. We'll just give them a slight sleeping tablet just to help them to sleep." So now they're on Ritalin and they're on a sleeping tablet, and things aren't going too well. They're still not sleeping too well. They're still crying at school. So they're giving an antidepressant, perhaps a Prozac or a mild sort of an antidepressant. Goes further and further along the line, and as they're getting this cocktail mixing in their bloodstream, the new diagnosis comes of a bipolar disorder. So now they're put on literally heavy psychiatric drugs. So it is not uncommon to see this happening, where kids are literally moved from one medication to the next, from stronger to stronger drugs almost. Another thing we're seeing now is higher levels of kids being medicated. When I was talking to some teachers who work in that area we talked about before, in that area of Geelong, they said that they believe that some of the classes have up to 25% of kids medicated. In America, there's now some schools that have nearly 100% of kids medicated. It's like almost a policy of the school. And there's schools in America now where if your child's been diagnosed and you don't medicate, that's it, you're out of the school. Medicate or hit the high road. So we're literally seeing almost an enforcement, of medication happening. And as I said, diagnosis and prescriptions being enforced by teachers and GPs with little information. This is what we're seeing more so in America, and it's starting to happen here in Australia, where parents are called in for the parent-teacher interview, and the teacher says, "Look, we're having some troubles. Have you thought about perhaps trying your kid on some medication to see whether it'll improve their behaviour?" Or otherwise you go to the doctor and start talking to him and explain some of the symptoms you're seeing, and he says, "Well, let's try some medication." As we said before, it needs to be more comprehensive, and it needs to be more multimodal in terms of the diagnosis. So this is the Skeptics, or the comics view of what's happening in our schools. Is SIBA is the major company, they're the company that makes Ritalin. You know, the theory is that they're making quite good profits out of getting Ritalin into as many schools as possible. In fact, the major support group in America is sponsored by SIBA Geigy. That's where they get all their funds from. All of their literature, all of their advertising that goes on the television is funded by the drug company that produces the Ritalin, which you could argue that that's a good community service, but guess what some of the number one thing that they recommend is Ritalin. You know, they don't even call it by its proper name. They actually call it by the proprietary name, the company name. So it does get scarier, because what we're seeing more and more now is that people are tending to go to the medication strategy first, and because of that, it's almost like they're not trying other things. So I don't need to think about parenting. I don't need to think about counselling. I don't need to do anything else. We're just going to try this medication, and that's a dangerous thing. The other thing we're seeing is the prevalence of ADHD kids in corrective centres and involved in social drug usage. We know that these kids are higher at risk of future, non-social behaviour, so to speak. The recent violent school crimes, one investigative journalist, she basically went through and looked at all of the cases, those really horrific cases of kids walking into schools and shooting each other, gang sort of assaults and those sorts of things going on. And what she found was this recurring history with these kids, that these were kids with long-term histories of taking psychoactive medications, and usually being on different mixtures of medications. So it gets confusing, because you think, well, is it because they're getting the side effects of the drug? Is that why they're doing these nasty things? Or is it just because these kids were so bad with their ADHD and the medication just isn't controlling them well enough? Maybe that's why. But we do know that these kids are at high risk, so we need to treat them with special gloves. So as we said, some of the side effects, the abuse of Ritalin, so if you're talking about the long-term uses of Ritalin, can lead to tolerance and severe psychological dependence. Psychotic episodes, violent and bizarre behaviour have even been reported. And that's what we're seeing in these school incidences, isn't it? These kids are literally doing very weird things that a normal person wouldn't want to do. And perhaps the best known effect of chronic stimulant administration is psychosis. So there's a potential link there. So as we said before, more is rarely best. You've really got to find, if you're going to go the medication pathway, you've really got to find the right dosage and the minimal dosage that's going to do the job, so to speak. There is a connection genetically with ADHD and addiction. Remember how we talked about the D2 gene? Basically, that is the same genetic defect that is found in all of the addictive behaviours and all of the compulsive behaviours. There's variations within that lead to different addictions and different manifestations of ADHD or Asperger's or autism. So here's the question that we need to ask ourselves. If we've got a child who's genetically at risk of these behaviours, they're also genetically at risk of future substance abuse. Now we're adding into their lifestyle a stimulant. You know, what are we perhaps doing in terms of the social message? You know, to behave normally, I need a drug. You know, to be good at school, I need a drug. To be a kid who's liked, I need drugs. You know, is that creating some sort of a social process that's going on there? So we need to think about it very, very comprehensively and very seriously in terms of, are we training or are we preventing addicts? There's actually conflicting evidence. Some research shows that people who are medicated are less likely to become addicts, and others actually show that they're more likely to become addicts, and no one can really understand why two studies measuring the same thing are finding totally the opposite thing. It's probably because of the populations they're studying, I guess. So do the tablets work best? Is that the way to go? As we've already mentioned, treatment should be multimodal, not left to medications alone. So this is the chair of the American Psychiatric Association. So sometimes we say, well, the doctors are telling us to take the drugs. No, the experts are telling us that we need to not just medicate. We need to look at this from a number of different levels.